Craniopathy, like the osteopathic discipline of craniosacral therapy, addresses itself to analyzing and adjusting fixations in the skull plates. Many of us have heard of full spine adjusting. Craniopathy addresses itself to the part of the nervous system that's above the spine. As I've heard said by craniopathy instructors, it's not all in your head, just 80% of it. Many of us are aware of the circulatory system and the blood-brain barrier. Craniopathy works to optimize circulation on the brain side of that barrier. The circulation of the cerebrospinal fluid that brings nutrients and oxygen to our brain and takes away byproducts, allowing it to do its many jobs. The bony plates of the skull are not completely fused. We know this because we found position sense nerves in the sutures, which wouldn't be there if there weren't motion to detect. The range of motion is quite small, 1/40th of an inch or less, around half a millimeter. But to trained hands it's not difficult to sense. Without this normal range of motion, we couldn't compensate for small changes in the fluid pressure inside, leaving us vulnerable to headaches, sinus issues, and other undesirable symptoms. Without this range of motion, circulation would diminish, and the brain would be left with reduced nutrients and energy with which to run your body and allow your senses and mind to function. Cranial adjusting is very subtle. As with any adjustment, proper position and contact are key, but the doctor uses very gentle pressure to guide your cranial plate back into its normal state. The real movement is accomplished by your own breathing with this guidance. Patients have described the experience of cranial adjusting as extremely relaxing, with feelings of buoyancy to the point of being in zero gravity. Cranial work is a great favorite among my patients.